I just left the doctor's office. I went to get a checkup because I've been off of Ozempic for 2 months now, and I just wanted to see if my body was in better condition, if there were any permanent damages. And I'm kind of in shock right now because I wasn't expecting this. But I guess Ozempic can cause bone density loss, and I didn't think that that would happen to me because I was only on it for a year. But I have significant bone loss. I have osteoporosis, and
I've been sent this video a few dozen times over the past day, and I wanted to jump right in to the big red flags that I'm seeing. First of all, number one, this person should have never, ever been prescribed this medicine. You can see this picture from a year ago, around when she started, based on the video, whether or not she had weight to lose. Number two, Ozempic's for type 2 diabetes anyway, so I don't know if she got Ozempic or semaglutide, Wegovy, or compounded. I have no idea. But if you can see that picture, she should have never been prescribed this medicine for weight loss. It's not indicated. Whoever is prescribing that, I don't know, big red flag. Second thing I want to go over is that as of right now, based on what she's saying, she says she has low bone mineral density, but we don't actually have the before DEXA scan to see that. We do know, based on what she's saying, she has that low bone mineral density. She mentioned osteopenia, osteoporosis, but we don't actually have the scans to show that comparison if the medicine did cause this. So let's get into the science. In the video, she talks about Ozempic and similar drugs causing bone loss and osteoporosis. However, when you look at the data we have, that is not what is shown. There's nothing about a GLP-1 receptor agonist that actually eats away at the bone. They've looked at various mechanisms and even have thought in the past maybe it helps with bone formation, but likely neutral. Interestingly enough, GIP, which is in the component tirzepatide, as opposed to semaglutide, which is only a GLP-1 receptor agonist, tirzepatide is a twincretin or a dual GLP-1 GIP receptor agonist. There may be some mechanistic data to show bone formation with the tirzepatide and the GIP component, but that needs to be studied. Losing bone mass is always a concern when losing weight, which is why we always want people to do resistance training and make sure they're not losing weight too quickly. There was a study with liraglutide, which is one of the older, not as effective brothers of semaglutide, where they combined it with exercise or looked at just liraglutide alone, and it did minimize that bone loss. So to sum it up, this person should have never been prescribed the medicine. I do not blame her. I blame the prescriber, whoever it was. And number two, there's nothing about these drugs that causes bone loss beyond their weight loss effect.